Hello, good day to you. I am Dr. Pubudu Liyanagama. I am attached to a coronary care unit in a private hospital in Colombo, Sri Lanka. Today I would like to bring you what are the treatment methods available if you get a heart attack. So, and what you should do. And the thing is that if you are at home or in some other place outside the premises of the hospital, it's better. If you are a non-heart patient, you should be having the GTN or TNT puff or tablets with you. So it's far more better if you have the puff because it is fastly acting, and you have to open your mouth and spray one spray under the tongue. Lift up the tongue and then spray it under the tongue. If with one spray or one tablet, if it doesn't cease off within 5 to 10 minutes, then you can get another puff, or another tablet. But don't take more than 2 puff or 2 tablets. If it doesn't subside the symptoms, then you better come to the hospital immediately. Even if it is not, after having the cease of the symptoms, better to come to the hospital and get it investigated. And what are the symptoms that you could get during a heart attack? You can watch in my very first ECG lecture, in the sense heart attack lectures, lecture number 1. If you subscribe this channel, then you can see all those lectures. The number 1 is, heart attack number 1 is the symptoms, all the symptoms that you can get during a heart attack. So it may not be the chest pain, it may be some other pain behind the ear, jaw pain, lateral part of the neck pain, upper part of the back of the chest pain, arm pain, profuse sweating, dizziness, faintishness, nausea-like feeling, headache, whatever it is. There are series of symptoms that you could get related to the heart attack. So you can observe, watch that video and come to know what are the symptoms you can get. So if you experience those symptoms, then if you are a non-patient, then you should be having the GTN puff, better to have it. And then if you are a non-heart patient, you should be having your aspirin and clopidogrel tablets with you. Take 300 milligram of aspirin tablets, take 300 milligrams of clopidogrel tablets, and if you have the lower cholestatin tablets to lower the cholesterol, then take 40 milligrams of them. And to prevent that gastritis-like feeling, pantoprazole tablets, if you have, take 40 tablets with little amount of water. Remember not to eat. Don't eat anything because sometimes we may need you in fasting condition. So if you are having such symptom, then it's better for you to come to the hospital immediately, preferably within the very first hour. If you get these pains in early morning, supposing 2 a.m. or something like that, don't wait till it comes to the dawn and then come to the hospital, because the time factor matters. Within very first hour, if you come to the hospital, we can prevent the damage could occur to the surrounding area of the heart muscle, because the center area is going to die and the surrounding area is vulnerable to die. If you come to the hospital within very first hour, we can prevent that damage, because if there's a heart damage occurs, then that heart muscle dies and it will not be replaced with the heart muscle, it will be replaced with the connective tissue, which cannot take part in the function of the heart muscle. So it's better for you to come early as possible to the hospital. Now supposing if you come to the hospital, what are the treatment options available for you? It totally depends on the hospital. What are the facilities available with that hospital? Suppose if it is a periphery or something like that, you may not be having the catheterization laboratory. So then it's better for you to get the treatment to liquefy that clot. There are some medication, so we can give those medication. Then after the medication, if you can afford, come to the hospital, come to a hospital where a catheterization laboratory is available, but come by an ambulance so that they can attend to you on the way if you become bad. So once if you can come to the hospital where you have the coronary angiogram facility, then there's an option for you to open up that block by inserting a stent. A stent is like a spring-like thing. It's a metal mesh-like thing. What we do is we through the radial artery here, we pass a wire up to the heart, and then we inject the dye so that we can observe the blocks or anything like that on the screen. So this is not a painful procedure because before inserting that cannula, it's a little bit big cannula through which we pass the wires. So as this is a little bit big one, we give you some medication so that you won't feel anything, because some people they ask whether it is painful. So it won't be painful because we give medication for you not to feel it. And then once we pass the wire, then we inject the dye, and with the dye, then we take X-rays, then we can see whether there are blocks or not. If those blocks can be opened up, that means we balloon them up. If there's a block, we balloon them up through the wire. There's a balloon, then we can inflate the balloon, then it will get, the block will get diminished, but it can collapse again. So to prevent that, we have to put a spring-like thing, mesh-like thing, you call it stent. And then once that stent is inflated there, that is also inflated so that it will be fixed there, so it won't move here and there. Don't worry, because some people they ask whether the stent can shift here and there. So such thing won't happen, don't worry. And the other factor is that sometimes when we do the angiogram, there may not be any blocks. You call it Takasubo syndrome. In those people, what really happens is that the artery gets constricted due to the stress, or if you get angry, something like that, then the adrenal secretion will be high, then the artery wall will become compressed. So then beyond that area there won't be any blood supply, so that there won't be any oxygenation, so the heart muscle dies. Whatever it is, ultimately due to lack of oxygen, you get a heart attack. But the difference between the other block and this situation is that the previous situation you get the cholesterol plaques deposited, and then you get some block, and those blocks can be opened up by putting a stent. Whereas here, you won't see any blocks because it is just a collapse of the artery wall. And once during the time that we do the angiogram, they have opened up. So there won't be any blocks. You don't have to insert any stents there. So how it happens, the mechanism I have explained in my heart attack 2 video. So if you subscribe my channel, you can see all the videos. Then if you watch that video, then you can understand how you can get a heart attack without a block. And during this procedure, we give you a dye. Some people who are allergic to dye, who have allergic reactions, they may develop an allergy to that dye. But don't worry, it's not a big issue. We can give some medication to prevent you getting any anaphylaxis reactions. In addition to that, this dye will be expelled from our body through kidneys. So if you have an underlying kidney disease, there may be some impact on your kidneys, but the problem is we can give some medication and some saline to flush them away, and it's better for you to do this procedure and open it up, because without doing that you may die with the heart attack, but we can prevent you from dying and attend to the kidney problem later. So it's better always for you to attend to the heart attack matter first, and then attend to the renal kidney impairment. And supposing after doing the angiogram, if they say we cannot put a stent, suppose if it is at a bend or something like that, or if the artery is diffusely blocked, or if you have multiple blocks, then rather than putting several stents, it's better for you to go for the option of the bypass surgery. The bypass surgery is that we cut open from here and then open it up. Because of that, it's a major surgery. So it is always better to, if there's any possibility, to go for the stenting procedure rather than the surgery. So treatment of choice wise, it's always better to go for the stenting, because if you undergo bypass surgery, then after some years, if there are any blocks, you may undergo another redo once. That is also depending on the capability of the cardiothoracic surgeon. Not all can do that. So, and after that, there may not be any options. So it's always better for you to first go for the stenting option, and then once we can do re-stenting after several years, something like that. And also, if those fails after multiple years, then you have the option to undergo the bypass surgery and the redo later. So sometimes they may say, if you have a multiple blocks, triple vessel disease, we call it, and suggesting for you to undergo the surgery, if there's no financial issue for you, if there is any possibility that you can put the stents for all those blocks, then it's beneficial for you to insert the stent, because you always have an option for you to undergo the bypass surgery later. Even if the block is 100%, we can put the stents, don't worry, because sometimes they may say block is 100%, so you have to undergo bypass surgery. So it is always better for you to take a second opinion whether you really need to undergo the bypass surgery, or maybe some other person would be able to open up this 100% block. Because it's totally depend on the person, capability of that particular surgeon, or not the surgeon, cardiologist. So it's always better if they have given you an option to undergo the surgery, bypass surgery, get a second opinion, no harm, because if can be stented, better to go for the stenting. Sometimes they may say the cholesterol plaque has calcium deposits, then it is very hard, like a rock. So once we can't open it up by ballooning with this angiogram procedure. Then also they may refer you to the bypass surgery, saying that there are calcium deposits. But there's another gadget available. We can drill that, like normal drill. This is a special gadget. We can drill that calcium deposited plaque and open up that blocked artery, and then we can put a stent there. There may not be machines available in all the units, only a few units that machine is available, and that can be done by only very skilled cardiologist. So only few people would be able to do it. So just because it is deposition of the calcium, you may not have to undergo surgery. Instead, you can do the rotablation, you call it, the drilling procedure. Supposing if all the options are failed, then you can go for the bypass surgery. and then after some years, if it gets again blocked, they can put the stent to those blocked artery, but if they can't, then another redo of the bypass surgery we can do. But always keep that option for the as the last option. Always go for the stenting procedure if there's any possibility. And just because we have done this procedure, it does not mean to say that everything is over. After the stenting, again it's like a mesh-like thing. So again it can get reblocked. So till because of that, till you die, you have to take some medication. So we prescribe you some medication which you should not stop. Till you die, you have to take those medication lifelong. In addition to that, if you smoke, you have to stop smoking because those are the criteria that could provoke a heart attack. If you want to know what are the criteria that can provoke the heart attacks and who are the people at risk to get a heart attack, you can watch my heart attack video number 2. If you subscribe to this channel, then you can see all the number of videos. Then you can watch them one by one. Actually, risk factors I have explained in heart attack number 3 video. Number 2 video I have explained you how the mechanism how you get a heart attack. So if you smoke, you have to stop smoking because how smoking affects you by generating heart attack, I have explained in those videos. If you watch them, then you can understand why the smoking contributes to get a heart attack. And also, you have to change your lifestyle. If you are a stressed person, then you have to adjust your lifestyle to reduce your stress. And also the food factor, you have to get an opinion from the dietitian, and you have to do the regular exercises, and you have to reduce your stress. So all those will help you to reduce the another heart attack occurring, because a person who got a heart attack already is at a higher risk to get another heart attack in the future than a normal person. If you want to know those factors, then you can subscribe my channel and watch those videos as well. So if this information was helpful to you, you can subscribe the channel, and you can watch the next videos which I am going to publish regarding cholesterol, how to lose your weight, and pressure, diabetes, and so on. For the time being, thank you for watching.